We're going to begin this hour with a dire new warning about the COVID-19 variants and the threat they pose. It's all being laid out in new analysis from Ontario's Science Advisory Table. CBC News has confirmed the data with multiple sources ahead of its public release next week. Here is one of the big numbers. Variants can increase the risk of death by roughly 60%. That's in comparison to the original COVID-19 strain, 60%. The findings also reveal variants dramatically rise in terms of increasing the risk of hospitalization and intensive care treatment as well. John Northcott has all the details for us this morning. John.
Good morning again, Heather. And these are stark numbers. And the concern around this is because of these new variants, as they are tracked around the world, the situation in Ontario and anywhere, frankly, is that it's believed the hospitalizations will increase, the deaths will increase, simply because of the nature of the way that they spread. So let's look at the numbers and then we'll break it down a bit in terms of the implications really for everyone involved in all of this. 60% increased risk of hospitalization, 100% increased risk of being admitted to an ICU, and a 60% increased risk of death. Now, these are from the numbers that we're expecting to see released next week that look at the situation in Ontario with hospitalizations from December to March, but also drawing in from around the world, looking at other jurisdictions that have dealt with the variants first. For example, B117 out of the UK. How do they deal with it, and how did they affect the situation? The real concern around so much of this is that in a time when indoor dining is restarting, patio dining is restarting, many parts of not just the Ontario economy, but many parts across the country are loosening those restrictions, that these variants transmit in a way that makes, even under what were lockdown conditions, a challenge to stopping the spread of these variants. Let's listen to Dr. Michael Gardam.
There's been a lot of hope that with the increased numbers of vaccines being made available, et cetera, that we'd be able to head off the third wave, so to speak, right? If we could just get enough people vaccinated, we could sort of stop this. And clearly, if you look at the trends in Ontario and most other provinces, we're going right back up as we were several months ago when we started wave 2. And we're starting at a much higher level, right? Because we didn't perhaps wait long enough to then start to reopen things.
And the numbers that we're seeing effectively echo what we have heard from various medical officers of health, academics, doctors right across this country in terms of the implications of this. And in terms of the intersection between those vaccines, which, as we understand it, largely are effective against the variants. On the other hand, they aren't out there in large enough numbers across a wide enough section of the population to stop the variants before they can do some significant damage. The next month to 2 months, in the minds of many, very concerning, with potential of outracing the vaccines, and that's why these numbers, as they play out, are going to be watched for as they're released. Heather?
Concerning in Ontario with these numbers specifically, concerning in provinces across the country. In Quebec, for example, John, variants are really changing things in various schools. Yeah, some would say playing havoc with the overall education system. Certainly the Teachers Association very upset about a lot of plans to reopen. So effectively what you're having is some of the largest English language school boards reopening next week and weeks beyond, a variety of grades opening up. But at the same time, the Lower St. Lawrence area, we're seeing 36 schools closed because of the variants of concern and concerns around that. So they'll be closing from today until the 6th of April. Something else to consider in all of this, not just in Quebec or in Ontario and other places like where we're seeing rising numbers and rising number of variants, for example, in Alberta and British Columbia as well. Holidays are coming up. Easter, Passover. In Quebec, we're seeing permission given to have 250 people gather in a house of worship. This after restrictions had it down to 10 or 25, depending on what zone they were actually in. And the concern overall, whether it be Quebec or Ontario or other parts of the country, from medical health officers and those who try to get the public to listen to these warnings, is the situation around the fact that when there is a loosening in public restrictions, people psychologically tend to think, oh, it's okay, and loosen whatever personal restrictions they may have on themselves and loved ones, etc. And that potentially, in the face of the transmissibility of these variants, is a real danger.